In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
Joining me in the studio is Dr. Lutz Harms, a neurologist at the Charité Hospital in Berlin. Welcome to the show.
Hello.
Dr. Harms, in multiple sclerosis, the immune system attacks the body, the nerve cells. Why does it do that?
Unfortunately, we don't know that exactly, but what we know is that there are activated lymphocytes passing through the so-called blood-brain barrier and inducing there's a damaging process, and that's a very complex situation.
And there were various theories about this, like infections or the hygiene hypothesis. What is this? What is the hygiene hypothesis?
The hygiene hypothesis means that we know that the distribution in the world is very different. Far from the equator, the incidence is much higher, and that are countries with a normally high standard of hygiene. The question is, plays that a role? Did it avoid the immune system of the child to fight against germs in the early childhood?
So on one hand side, it's about germs and bacteria maybe causing MS, and on the other hand, it's the lack of those germs that may cause MS.
Yes,
isn't it contradicting?
All that are hypotheses,
yeah.
And what means we have the virus hypothesis, Epstein-Barr virus seems to play a role, but that means that in a later age, the infection with this virus can be inducing the MS.
So all theories, are there any theories you would personally favor?
No, because no one factor alone can cause MS. I think that we need the genetic predisposition and then the interaction with environmental factors.
Okay. And what are the first signs of MS? So when does a patient need to fear that he or her caught MS?
The most patients come with an acute attack to the hospital. Very different symptoms can that be. Visual loss is very often, weakness, tingling sensations, and a wide range of symptoms. And that's the first sign of. It can also be progressive from the beginning.
And what is the immediate therapy a doctor needs to apply to the patient when the first symptoms arise?
In the acute attack, we use high doses of cortisone to shorten this attack. But then we have to, if the diagnosis is sure, then we have to continue prophylactic treatment to avoid further relapses.
And what kind of therapeutic approaches are there for the prophylactic therapy?
Today we have a lot of drugs with different approaches. We can decline the activated lymphocytes, and we can try to avoid the passing through the blood-brain barrier.
Mm-hmm. And some patients seem to do quite fine with MS and with no relapses and no problems and all, and others end up being in the wheelchair. Why is that? How can that be explained?
It's difficult to explain, but we know it's not one multiple sclerosis. Seems to be a wide range, heterogeneous disease. So we have benign causes of disease and very aggressive. That's a kind of genetic predisposition, we think.
And can MS be healed?
Not today, that's a dream for the future, but we can influence it very good today to reduce the relapses and to slow down the progress.
And you and your co-workers at the Charité Hospital try to influence the MS with some new approach called the ketogenic diet. How does this ketogenic diet help the patients?
That's a big question. It's very popular, but we have only very few data about this diet in MS patients. There's the first little pilot study. We cannot recommend it today. We have to wait for a larger study. We know in the mouse model it acts very good, but it's too early to recommend it.
So in mice it would help, but when it comes to humans, we just don't know enough about it.
We are no more mice.
Yeah, right. So you're not suggesting the ketogenic diet to your patients right now?
Not today. We try, if one is interested, we try to take him in the study to get more data about this diet. It's promising, yes.
But as it's just a diet, there are no side effects involved, are there?
Yes, there's some side effects, but I think the risk-benefit is on the side of the benefit. But we have a lot of other treatment, and the patient has to decide what does he want.
Okay, great. We've got plenty of viewer questions. Regina Fokina from Russia wants to know if she can pass on MS to her children.
Not directly. As I mentioned, there are genetic predisposition. For example, if identical twins, if one has a disease, the other has a risk of 30%. If the mother has MS, the risk for the child is about 5%.
So it's just one factor in a lot of factors.
One factor, and there are many genetic factors, and every genetic change increase the risk only a little bit. But the environmental factors seems to play a larger role.
A bigger role, yeah. So environmental factors and perhaps lifestyle changes. Our viewers Hat Thi Quang Lee from Vietnam and Red Ahmad from Uganda want to know how lifestyle changes can influence the course of MS.
It cannot change the course, but it can slow down the beginning of the MS in some patients. We know that smoking is a risk factor for start of the MS and also for the speed of the progress of MS. So the recommendation is clear: no smoking. Other factors may be not too much stress, enough sleep, and a healthy lifestyle. Food, of course.
So it all comes down to a healthy lifestyle and not only to genetics.
Not only to genetics. That's only one little factor.
Okay. Thank you, Dr. Harms, for being with us in the studio today. Thank you.
Thank you.